Welcome to the Betty Rocker Show, the place to be to nourish your mind, love your body, and rock your life. What's up, rock stars? It's great to be with you. Today, we're welcoming Dr. Jill Carnahan back to the show to talk about some things that have been on my mind to share with you, including what blood tests do we really need to get a good snapshot of our health? Can we get them from our doctor? And how affordable are they really? I'm also talking to her about the different hormone treatments available for women who have imbalanced hormones, the pros and cons of the different types of treatments available, and how frequently you should test your hormones once you start a treatment plan. Plus, I've been super interested in how COVID affects our hormones and our immune system and how this is playing out for women at different life stages. Now, if you haven't heard of Dr. Jill Carnahan before, she's the functional medicine doctor I trust and work with personally for my own healthcare. Her clinic specializes in searching for those underlying triggers that contribute to illness through cutting-edge lab testing and tailoring the intervention to specific individual needs. She just released her new book, Unexpected: Finding Resilience Through Functional Medicine, Science, and Faith, where you can read more about her incredible journey through facing breast cancer at 25, autoimmunity and mold toxicity while working in the conventional medical system. And her book shares her protocols for environmental toxicity and mold-related illness, autoimmune disease, Lyme disease, and countless other complex chronic symptoms from over 20 years experience practicing functional medicine. You can read this book, and you can also learn a ton from listening to today's conversation about the topics I mentioned we're going to talk about. So join me in welcoming this amazing woman back to the show. So great to have you here.
Thank you. Always good to be with you and your awesome energy.
It's just such a treat to have you back. People were talking about our last couple of conversations. The first conversation we had, we talked about mold. And both of us have had that personal experience with it. I was fortunate enough to have you as my doctor going through healing from mold. And our last episode, we talked about a lot of women's health topics. And there's just so much we could cover because you're an amazing functional medicine practitioner with such a wide breadth of knowledge. I don't even know how you have time to fit this in with all your patients. How long is your waiting list right now? Last I heard it was 3 years long or something. You're so popular.
About 5 years. Yeah.
Right. Yes. I feel very, very lucky. But that's again why, you're writing books, you're putting out publications on your blog, you're talking on podcasts, you're out there sharing the information that you use in your patient practice, which is so valuable. So thank you again for
You're welcome. Thank you. It's actually like I would do it if I didn't get paid, right? It's one of those things that I know I'm called to do in this world. So yeah, thank you.
That's so true. And speaking of your amazing blog, which everyone should check out over on drjillcarnahan.com, you had a recent article that I shared in my group. I was talking about with a lot of friends. You were talking about the tests that everyone should get, like the types of testing that people should get. And I think this is a topic that a lot of us are really lost, unless we have a practitioner like yourself or someone who's really educating us on what types of tests are important. And then maybe like, how do we ask for these tests? And then how do we read these tests? And what's important to know? I guess that's my question to start us out is what tests should women specifically be getting at maybe different ages? And what are your recommendations in that regard?
Okay, I love this. And I did write recently about this, so it's all out there for free if you want to just resource or whatever. But the bottom line is, so often functional medicine seems like this unattainable thing where you might have heard, oh, this sounds great, but my insurance doesn't cover it, and I can't find a doctor that's available in my space. So what I want to do is give you, and most of these that I'm going to talk about are actually ones you can do through your insurance. So a lot of the comments I had when I wrote the blog and posted it were like, oh my gosh, that's totally unavailable for the average person. That's not true. And that's why I wrote it, because these are things that LabCorp, Quest, your hospital lab, I'll tell you which ones are and which ones aren't, but most of them are completely available. Now, the other thing is getting a doctor to order them. That could be an issue, because say you're in a HMO, the doctors are kind of capped at like what they can do. And they're often like, you need to have this symptom in order to order this lab. So they might be wanting to help you, but they are handcuffed a little bit by the system. But nowadays, there are direct to consumer labs. And there are many, many platforms. I don't even want to start naming because I don't want to play favorites. But if you look up direct to consumer labs, you can often order these yourself for a fraction of the cost. And what people don't know is, say you take LabCorp, Quest, or any major lab, the lab rate they charge the insurance is literally almost 10 times what the actual price is. So for example, if I order a huge panel of all these labs, it could be $8,000 that's billed to the insurance. And everybody's like, oh my gosh, that costs so much. Well, first of all, if you have a normal good insurance plan that covers regular labs, that 8,000 will be deducted to 800 and then taken to your insurance, goes toward your deductible or whatever. And you might be billed $200 or nothing. So it's very, very tricky, because these companies are making money and they're billing at a high rate because they know they're going to get denied. If you directly go to like my local hospital, which gives direct to consumer prices, that $8,000 bill would be about a tenth, somewhere between $500 or $800, which is still a lot. But I'm talking about a load of labs, like loads and loads. So you
right,
could
you're
decide,
giving one example for
yeah,
specific.
and
And as someone who's gone through this, I have to say what you're saying is exactly right, because I've had, so I can say specifically, like I'll say which labs or the direct consumer, and you tell me if I'm saying the right ones.
Sure.
Vibrant America was one of the ones that I used. And another one, it starts with an R. It's what is it?
Rupa
Health.
Yeah.
Yep. So there's two right off the bat that I'll say, like, you're not playing favorites. I'll just say two that I've had the experience with that are direct to consumer. And those, it's kind of amazing. So what you're saying is really true. It does actually, you can actually get your insurance to cover it. Because I think, like, I'm so glad you addressed that sort of elephant in the room. It's like people hear about these great things and then they're like, oh, but that's not attainable
not
for me.
accessible. And I'm saying it is. And let's talk, I'm talking, when I talk about large number, which is $8,000 that's billed to insurance, maybe and that's talking like a massive workup at an incredible depth.
Sure.
If you still just want this basic stuff, we'll start with CMP, CBC. I'll explain what these are in just a moment. And basics, you can go to local hospital and get it for $150, $75, somewhere between $75, $150. So you can get these for very reasonable cost, and that's outside of insurance. If you go through your insurance, it's often discounted. And thanks for letting me frame that, because I want you to know as a listener, this isn't necessarily inaccessible or only for the wealthy. It is absolutely accessible, and you can decide how deep you go and how much you pay. So thanks for letting me share that.
No, 100%. And now, and also, so now you're maybe, what's the next framework that we should offer? Like which age group do we want to talk? Like maybe you would say different age groups would need these specific labs or these specific lists of things. So get out your pen and paper, guys, or take notes in your phone if you're interested in.
And I'll go into detail here in a minute. Okay. I love that. When I wrote the 15 lab tests you should have by the age of 30, I just picked kind of this average age of where in our 20s, we think we're invincible. I happen to get cancer in 25, but up until cancer, I was like, I'm great. I'm never going to, like we think we're, immortal, basically. Like we're thriving, everything. 30 starting to be the point, somewhere between 30 and 40, where we start to be like, oh, I'm waking up a little sore in the morning, especially after 40. So I would say, absolutely, if you haven't gotten an in-depth workup and you're 40 or above, this is for you. But I think it's more important to see patterns of where you're walking towards on your trajectory towards health or disease, because often you can start to see abnormal patterns in your 30s, even though you feel great. And so this is like preventative. You're looking at these patterns before you ever get, because by 40 or 50, there's some inset things that you might have more trouble reversing.
Makes sense. So that was a great article. So if we were to say, if you're in your 30s and you have the opportunity to get this lab test that Dr. Jill is going to go over right now, great. If you haven't had anything like this and you're in your 40s or 50s, this would probably still be very appropriate for you. If you just to get some baseline numbers, and then you could tell us like what to do in the future to follow up. Okay, so that's a great framework. Thank you.
And if you're a motivated 25-year-old, by all means, it's perfect for you too, but you're probably going to come up pretty normal because you haven't yet had that time and exposure and everything. One thing on that real quick too, I keep going on these tangents, but I think they're important. You could be born with a genetic predisposition towards something like celiac, but the average age of diagnosis is 55 years old because what happens is over the years, you might start to have inflammation 30s, 40s, and it takes an accumulation or a load of environmental toxicity of gluten in the case of celiac and things to actually manifest as full-blown disease. So the reason we're saying 30 and above start this kind of testing is because we want to predict where you're headed and turn your course around, change course, so that you don't ever go to diabetes or you don't ever go to gout or these things that we can actually prevent.
Amazing.
So yeah.
That's great advice.
Okay, so let's dive in. So CMP is a comprehensive metabolic panel, and this is a basic thing that looks at your liver function, your kidney function, your absorption of nutrients and proteins, your electrolytes, and even calcium. So it's kind of a really basic metabolic panel, and it's something that most doctors probably have ordered. So it's not something that you would be shocked, like your doctor would be probably willing to order this. At a lab that's doing a cash pay price for this, it's probably about $10. So it's that cheap to do. Complete blood counts. This is where you look at platelets. Platelets can cause clotting issues. And if they're too low, you're going to have bleeding risk. If you're too high, there's inflammation or risk of clot. It looks at hemoglobin. So if you're anemic or B12 deficient or have chronic inflammation that's causing some reason to have low hemoglobin, it might be a reason to explain fatigue. That's all part of the CMP. And then white blood count, I look at specifically because if you have a chronic infection like Lyme disease or Epstein-Barr, you can have a chronically low white blood count. And many doctors be like, oh, that's just normal for you. And if I see say it's a 3.0, which is low, usually the normal is somewhere between 4.5 and above, I'm looking for a chronic infection in that patient or something that's creating a stress on the immune system. So again, a lot of docs will order this. This one will probably be about $15 cash, so pretty affordable. Advanced lipid profile. There's many different forms of this, but the main thing here is you get the cholesterol, the LDL, the HDL, the triglycerides, the oxidized LDL, the apoprotein B, and the lipo-A. This itself is a whole 2-hour lecture, but the bottom line is this. Cholesterol is not all bad. Cholesterol is a precursor for all of our brain. Our brain is actually made of fats and cholesterol. It's a precursor of all of our hormones, including adrenal, thyroid, and endocrine hormones. And so if we have too low a cholesterol, we can actually be deficient in hormones and things that we need to survive. So it's important to find this balance. The problem with cholesterol isn't just pure cholesterol. The problem is oxidized cholesterol. So if you have reactive oxygen from stress from our chemicals or things that we're eating or stress in our lifestyle, and you create oxidation, it's almost like rust on a car. That's what oxidizes iron. And you basically create rust on your lipoproteins. That's the damaging kind of problem. It's not the LDL or the cholesterol itself. So you really want to look at a profile that looks at oxidized LDL or the particle size of the LDL. And again, this is more than we can get into here, but it's more important than just pure cholesterol. So don't ever take your pure cholesterol number for an end all be all because it really is meaningless. It's good plus bad, which means it's neutral. So it's just important to think about that. Inflammatory markers. I'm a big fan of these because these can be predictive as where someone's headed. Things like CRP. This is just a non-specific inflammatory marker that can indicate a hidden infection, like in your jaw, maybe a strep or a problem in your throat that you maybe didn't know about, or some infection. And if that's high, there's usually a reason. We just have to say what's causing it, and it could be anywhere in the body. Homocysteine is a great marker of methylation, which is a process that breaks down damaging chemicals. It repairs DNA, and it helps immune system and neurotransmitters like for sleep and mood. So if you have a high homocysteine above about 9, in some cases, like with brain issues, we look at below 7. So 7 or 9 are kind of good numbers to look at. And again, you want it below 9 or below 7 in some cases. And homocysteine tells us, do you have enough methylated B vitamins, methyl B12, methylfolate, B6 and riboflavin, and if you don't, it'll start to creep up. I've seen people as high as 27 or 30, and we know there's a massive issue with methylation, which, like I said, repairs DNA, prevents cancer, makes neurotransmitters. So super important to have your homocysteine below 9.
I'm just going to interject just for a quick second here to say that these all sound very familiar. I feel like over the last 3 years, you've tested all of these things on me. But one of the really interesting layering pieces that you did because of who you are and what you look at is you also compared my results to what my DNA, what my genetic background is, which I think is a really essential piece. If you're wondering, does someone have the MTHFR gene,
Yes.
which will allow them to methylate properly? That's what made me think of that just now. So interesting side note, but also yet another reason why, I mean, this stuff is so fascinating because we are all so unique, and your results might be like, you could have the same results as mine, but how we express things and what is going to bother each of us or make each of us thrive could be different because of our genetics.
Yes, this is so true and so important because, again, when there's a homocysteine issue, I'm like, okay, what caused that? And if someone you've heard of MTHFR, you mentioned that that's a common cause of impaired methylation. And so that would be one of the reasons. And if someone has MTHFR, they're going to require more B vitamins than someone who doesn't. And I can actually mark progress by how low we get that homocysteine.
Yes.
So it's kind of cool. You can check that in. TMAO, this is a big one in the cardiovascular. If you've ever heard of cardiovascular markers, TMAO is something that your gut metabolizes from choline and carnitine and typically fish or chicken or meats. And it's kind of, well, it's not kind of, it is a risk factor for heart disease. However, it's the gut microbiome that produces it. So say you have a high TMAO and your doctor checked, you're like, oh no, I need to cut out fish and chicken and all these wonderful proteins that are clean. The truth might be maybe temporarily, but the real root there is microbiome. So you can go back to the microbiome, fix the microbiome, change the microbiome. And sometimes it's not the carnitine, which is a great nutrient, choline, which is a great nutrient, or fish, wild salmon, for example. But in the conventional world, we say those things will increase TMAO, so you need to avoid them all. And the truth is, you fix the microbiome. That's a big one.
And we just got to talk to Dr. Pedre recently all about gut health, which was so helpful. And it's really intriguing and important for us to learn as much as we can about how our bodies work and how to take care of them through just our day-to-day life practices. I have not yet met one doctor who I've interviewed or talked to or worked with who didn't tell me how important it was to pay attention to my own practices in my own day-to-day life, that whatever treatment protocol they had me on, I was also going to need to pay attention to my sleep, pay attention to my stress levels. What was I eating? Was I paying attention to my gut health? Was I exercising? Like those pieces are the responsibility of each patient to the best of their ability. All or something, guys, not all or nothing. But,
right.
It's like all of these tests are so great, but then what are we doing ourselves on the other side of that? Like you mentioned, the gut microbiome, which, it's just a favorite topic around here because it's such an important part of the other side of like, we eat something and how does that influence our gut? And then how does the gut talk to the brain and the hormones? And then what shows up on a blood test, like you're talking about, like this TMAO, like how interesting that connection is. It's all so interconnected.
Because we never used to think like the gut microbiome kind of back burner, it's important, but now we realize so many of the drugs we use, so many of the chemicals we get exposed to, they don't necessarily affect our cells, but they affect our gut, which then affects our body. So it's very relevant. Those are just some of the inflammatory markers. There's even more, but those are the big ones. Heavy metals are a big deal because we're all getting more and more exposure.
I'm glad you brought that up.
Especially out here with wildfires, we know that there's chemicals in the building materials. In California, Colorado have been particularly affected last year and the last several years by wildfires. And wildfires, we saw, you'll be surprised, maybe not surprised, but after the wildfires, we saw these kinds of inflammatory markers in people's blood in my community where there was lots of houses that were burned that looked like someone who had massive mold exposure because the same kind of inflammation. So heavy metals are a big deal. And there's several ways. I'll try to be real simple with this. You can test these in the blood. They're going to be recent exposure. They're not going to be body burden. So it's very easy to get a heavy metal test in your blood. And it might show if you had shark and swordfish and some hot tuna and eating some high mercury fish, you might see mercury from recent exposure, but it won't really test your body burden. To get the body burden, you're going to want to do urinary excretion. And you're probably going to want to do that with a challenge like with your doctor's prescription for DMSA. That's a little more complicated, but at the very basic, you can get blood tests through any regular lab of heavy metals, and that's important.
That's so important. I remember back when I first got my sauna, my infrared sauna, I had really high levels of different metals. And after I got tested again a year later, and they had gone down so much. It was amazing when I actually focused on it. It was a big deal. So that's an important test, because
And I love that you
consequences when you have high levels of metals in your system. So
yeah, these really affect the kidneys and function of brain. They can deposit aluminum. It's been shown to be associated with Alzheimer's. So kind of some really nasty things. And I love what you said too, because what happens when we start to detox, often mold will trash our detox system. And in the moment, if we've had a mold exposure, some really toxic exposure, will look really toxic with metals. But as we sauna and detox and get this out, the metals will come out. But it actually, because our detox system's working, it's not as big a deal as it was when we were really toxic with mold or other things like that.
Yeah, side note for those of you who are really curious about the mold conversation, Dr. Jill and I had that last season, or we in one of the you should listen to both of our episodes together, but that was a deep conversation that we had about my current treatment plan at the time, and all the protocols. So if that's a topic of interest, go listen to that episode, because it's a great one. And thanks for that.
Yeah, we went deep, didn't we? Thyroid, of course, you've heard about this. This is probably more talked about than anything else, but let me just be real brief and quick. TSH alone will not do it. It will not tell you the full picture. You need to look at T3, free T3, T4, free T4, and then all your thyroid antibodies. And that way you get a big picture of what's in the blood, what's active in your thyroid. Do you have enough, both T3, T4? Are you converting? And do you have the brake pedal on that, which is reverse T3? And by looking at that with a doc who knows what they're doing, you can kind of see, you might feel like you're hypothyroid, but your TSH is normal, but then you have very low T4 or T3, and you really are functionally hypothyroid, but you won't catch that unless you do that full panel with the thyroid.
That's that's a big one. I think a lot of people struggle with, because they'll come to me and they'll say, but I went and got my thyroid tested, and it was, doc says my thyroid's normal. And we know that maybe they haven't looked at everything that you just went over, or, there's just not as much depth in the looking. So that's an important topic.
It is. Years ago, after I had celiac and Crohn's and all these things, I was measuring normal TSH, and I had so low of T4 that finally went into endocrinologist like, Jill, you are severely hypothyroid. You don't have any T4. But it took, and even at that time, I was just getting into functional medicine, and I started to realize, oh, some people can have this. It's basically dysfunction between the talking of the hypothalamic pituitary and your actual thyroid gland, and mine wasn't communicating. So I actually had a significant hypothyroid, and it wasn't measurable on TSH.
Interesting. Right. And like you're mentioning that transition that you made from being a, conventional medical doctor to becoming a functional medicine doctor. There's a lot of additional training. There's a lot of additional school and reading and research and all this certifications and stuff you have to go through. And like, you're so helpful, because you're like, hey, I went from this where we didn't know what the issue was to, this deeper level of research. And that's when we were able to uncover it. And I think, this is why I really enjoy talking to functional medicine doctors so much, because there is such a depth that you bring to the practice of healing people. It's a real art and science kind of combined, I think.
Thank you. Yeah, it does. It's a lot deeper. And the funny thing is, most of your docs who were trained in medical school learned the biochemistry at some point, but then they kind of went to more prescription. And again, nothing wrong with that. Drugs are appropriate, but there's way more. So if you're not getting answers, yeah, keep asking questions. Don't be afraid of that. Hormones. Oh, we could do a whole episode on hormones, but we'll talk real briefly. So you can do blood work hormones, and they're decently good. And they're actually a great way to get covered by insurance, where you really look at levels. Typically, I'll recommend free and total testosterone, estradiol, maybe also estrone, which is E1, and estriol, which is E3, and estradiol is E2. So those would be all the estrogens that are the main ones we use. And then DHEA-S, which is the type of DHEA you measure in the blood. Cortisol is really important. And usually we do morning cortisol before 9 a.m. because that's kind of a standard. And you can do pregnenolone, so you can go a little deeper. Those things are easily available, but if you happen to be transdermally applying hormones, you're not going to see that show up in the blood as much because it goes into the tissues. So if you're measuring how you're responding to a hormone that you're putting on your skin, the blood is probably not going to show you what you want to see. And in that case, then you go to something like Dutch Hormones is my favorite company. I have no association with them, but we've done that before. They look at all the different metabolites and wherever it's like a map. You're looking at this map of all the hormones, and I can tell as a doctor what they're doing with either the hormones I'm giving them. And because it's measured in the urine, it's more accurate for tissue level. So if you are applying hormones to your skin, you're going to want to do this kind of test. Now, this is typically outside of insurance, but it's a few $100s. It's not crazy expensive. And there's multiple different companies. I just mentioned one that we use frequently.
That's one that you and I have used frequently. And the Dutch might be something like, first, we're talking about blood panels that you may want to establish a baseline with.
Yes,
Jill's
yes.
giving you like a bonus, like one, and this might be something for follow-up, or if you notice that something might be off in what you're looking at in your blood work, then maybe it's time to talk to your doctor about going deeper and doing the Dutch test, which is exactly why we used it for myself when we were trying to balance my hormones. So that's super helpful. And we are going to talk more about some specific things about hormones coming up here in a few minutes, but I want to let you get through the rest of whatever else you would tell us to test, because this is incredibly valuable.
Yeah. So hang with me. These are all super important. And the last few will go a little quicker. So autoimmunity, there's ways to screen. So we call it predictive autoimmune. And there's one that was real common. Your doctor's probably tried if you've ever asked for autoimmune. It's called ANA, anti-nuclear antibody. We think of this as kind of the doorway into autoimmune disease. And you might have a positive ANA, but really feel okay or not be testing for rheumatoid arthritis or anything like that. But if you have that positive ANA, that means your body's already developing antibodies to your own mitochondria, your tissues, it's actually to part of the DNA of the cells. So that's telling us there's something brewing, even if you don't have a full autoimmune disease. So as we talk about trajectory and where you're walking on that trajectory, this would be a sign if your ANA is positive that you need to look deeper, maybe at the gut, maybe at the immune system. And there's ways to do that to say, what's triggering my immune system to start to attack myself? And so that just tells you, do I have a proneness to develop autoimmunity? And if you do, you better start looking at things that are triggers so that you don't have to go into full-blown autoimmune disease.
I can already feel like the sort of anxiety that some of my listeners may have in listening to you go over all this, because they feel, oh no, what if I have to read these results myself? I just wanted to share a personal share about my own results, because when I've gotten them back, I usually get them back before Dr. Jill does, or like at around the same time that she's going to get them. And we may not have a check-in visit for a couple of weeks. But what I've found is that these results are quite clear. They're usually showing you a range of what's normal on the chart. But then all it's taken me is a brief Google search to find out a lot more about what that specific marker is testing, about what positive and negative and, the spectrum of that is. So I feel like I've been really proactive in being a patient. And even if I wasn't working with you, I would know a lot just from looking at my own labs. And even if I had maybe a different type of doctor who wasn't a functional medicine doctor, I would still be a lot more educated and a lot more able to converse about these results. Because these labs, when you get them back, you can see, like they give you quite a lot of information about everything. And then you can just go look up yourself. I mean, you do these days really have to kind of take your health into your own hands. Even Dr. Jill working with me, she doesn't have every answer I ever need. A lot of it comes from like us working together and dialoguing and figuring it out and looking at data. But that's something you can do too. Like you can take your health into your own hands. I hope you get to work with a wonderful doctor like Dr. Jill. But if you don't have someone, this is still accessible. I guess I just want to make that clear.
I love that, because you're right. And nowadays, a couple of years ago, it was there was new law. So before, the doctors would keep the labs and the patients didn't have access, which I think was terrible. I think this was the best thing that ever happened. Now it's actually a law that you as a patient, whether or not you see a physician for follow-up, or no matter when is your follow-up, you get access to the labs. That's your right. So don't be afraid to ask. If the lab doesn't release them to you, which they should, don't be afraid to ask your doctor before the visit, or if you don't end up doing a follow-up, whatever it is, you have the right to this data. It's yours. So
yes,
really important.
Thank you. Okay, yeah. Please continue.
Okay, yeah. So immunoglobulin levels, this is something that's not common and I find to be absolutely essential. This is our antibodies. Our B cells make antibodies IgG, IgM, IgA, IgE, and they all do different things, and your doc's going to know what they do. But just knowing that you have normal levels of all of these is really important, because if you don't, that's a sign of an immune deficiency, like especially a low IgG level, that's your total antibodies. And I always check this because a lot of people are suffering from chronic infections or not feeling well. No docs ever check this. And I have discovered dozens and dozens of people with an immune deficiency that no one's ever diagnosed. And it's pretty simple, and it's a simple test. It's not hard to get, and it's affordable.
That's very helpful. And I know these are all things I've seen on my blood work that you order for me. So it's just fun to hear you talk through them all and think about, how someone would feel if they were hearing this for the first time. Is that the complete panel of stuff that you would order, or is there something else?
There's a couple more. And just two or three more. So metabolically, we want to look at glucose is going to be in your comprehensive metabolic.
Right.
But I also usually order fasting insulin. That should be less than 5 ideally. And I order A1C, which is an average blood sugar over about 3 months. That should be less than 5.5. And these are ideals, right? Because you don't really become diabetic unless they're a lot higher. And then fasting glucose. So if you look at those 3 things, your fasting glucose should be below, I like it below 90 and for sure below 100. Your A1C, your average sugar should be below 5.5. And your fasting insulin should be below 5. And if you have those all in order, you're not walking towards diabetes. And if you don't have those in order, this is a good sign of maybe why you can't lose weight or why you're not feeling well. When you skip a meal, you have a metabolic inflexibility. There's other things here that can be playing. So that's just a good check for your metabolic flexibility and if you're prone to diabetes. And the last few, vitamin D, so critical. It is like part of our immune system. That's easy to get. Vitamin D, get that. You should be, I think 50 to 80 is an ideal range. If you can tolerate a little higher. So if you're 90, you just had COVID, you're fine. Don't freak out. And below 50, below 40 for sure, there is clear evidence of risk of infection and even death from COVID when it's below 30. So vitamin D is a huge one. Those are really the basics for serum. I talk about a few other specialty like micronutrient, celiac testing, fatty acid testing, and a few other things. But the other stuff is usually the specialty labs and some of that other stuff. And if you get all the things that I just talked about, you're going to have a real good snapshot of where you're at with health.
And then as far as following up from that, like say you got that snapshot, you got that nice baseline, and then you were like, okay, let's say we saw some things, we addressed those things. We'd want to get a follow-up for the specific labs that were abnormal. That would be the standard practice for how we would make sure that the protocol or the treatment that we followed was working for us. And how long, this is really too general of a question, but how is it something that we'd want to test within 6 months if we followed a treatment? How fast should we expect general treatment protocols to take effect? How soon should we get another
Great
test?
question. So there's a few exceptions, like say there's a really high CRP. I'm like, oh, something's going on. Let's check your dentition. Let's treat with an antibiotic if there's an infection and then retest in maybe 8 weeks. But other than that, what you just said, 4 to 6 months is a great standard for retesting. So many people who are pretty normal, a few abnormalities, 4 to 6 months is when I would retest.
And you just retest the things that were abnormal, generally speaking, right? And then you might do another full workup maybe every decade or every 5 years or annually. What's sort of like gold standard for?
I would probably, in my patients, because I'm following them every year. And now maybe not everything, because once I know the pattern, so I'm going to throw out this big net like fishing, right? And saying, okay, what are you so you're predisposed to metabolic syndrome and inflammation. Well, then I'm going to focus on those things. And every year, maybe even every 6 months, do those. If your thyroid looks great, we might check once a year, but these are still pretty basic. So most of the ones I just described, I will probably do those at least every year for patients.
That's helpful. And then let's shift to my particular audience who's really interested in their hormone health and testing their hormone levels and also treating hormone imbalances that they find. This is the one specific treatment that I'd like to focus on in our conversation, because over the years in working with you, and even other people I've worked with, I've experienced different types of treatments for when my hormones have been out of balance. For instance, when I was exposed to mold, my hormones really tanked. My testosterone was really low. My estradiol was specifically of the 3 different estrogens in your body. That one was super low. And that's the one that helps us make muscle and have drive. And that's the one you don't want to be low. So those were, we treated me in a variety of different ways. We used creams for the most part, since I tended to want those and responded well to them. And then I slowly transitioned off of all of those supplements and got onto, I'm calling them supplements, but they are supplemental. They're more prescriptions. I transitioned into using adaptogenic herbs and supplements, and I was at a great place with all of those until I got COVID. And then I tanked again because, as you've educated me, COVID is one of those things that really attacks our hormone levels, especially after women my age, in my mid 40s, have had COVID. So the floor is yours. Talk to us about the different treatment options available for us as women who need hormone therapy support, why you recommend different things over others, and then we should also talk about how COVID attacks us.
Yeah. And I'm going to kind of weave that in the beginning because I think many listeners, it's so relevant. Many of you are like, what just happened after COVID? Like, I recovered. It wasn't a severe illness. But COVID has this really significant impact on our immune systems and particularly our adrenals. And if you're in your 40s or 50s, what's happening is you're maybe perimenopause or maybe kind of hanging in there with normal cycles. And I've seen over and over again, if someone's kind of on that borderline, post-COVID, they kind of dump into menopause. They tip over that cliff. And the reason for that is COVID has a particularly strong effect on the adrenals. And when we are going towards menopause, our adrenal glands actually pick up the slack. So when our ovaries stop producing that amount of estrogen, progesterone that we need for our cyclical cycles from 30s and 40s, early 40s, our adrenals will start to kick in, and we can actually go through perimenopause for years, for 3, 4, 5 years, if our adrenals are really strong. And those with strongest adrenals are going to be the ones that, I don't really notice menopause symptoms. I feel fine, because their adrenals it's kind of just very gentle from the ovaries to the adrenals, and they pick it up and take the balls, like passing the ball, right? And so postmenopausally, our adrenals carry the load of producing hormones for us, and we definitely go down. But what we've seen, the reason any virus, even like Epstein-Barr or CMV, could also do this, but because so many people have been affected by COVID, we're seeing a large amount of women in their 40s and 50s that after COVID, they go right into menopause because their adrenals are in a weakened state. So that's the framework of this and why people are seeing more issues after, and then what to do about it. Well, like I said, you can have your blood work tested by your doctor, and usually it's covered. You can go deeper with the Dutch or any urine or saliva tests that will actually look at deeper levels. And you want to kind of see what's happening. And then you can get a plan together to replace that. One of the things I was so proud of you doing is you did an amazing job with adaptogenic herbs to really support. And I think a lot of women, if they're kind of teetering and they're not fully blown, I prefer to do herbs because herbs are kind of like this warm blanket for our body and hormones, and they're very gentle. They work, if you're high cortisol, they might lower it. If you have low cortisol, they might raise it, but they work synergistically with your own body very gently. But then sometimes we kind of fall off the cliff. I did that too, and we need a stronger support.
Yes. Yeah, no, and I'm glad you're sharing. Like because I really wanted to talk about like my own experience, because I feel like it mirrored so many people, and maybe if it wasn't the same as someone else, there's something relative about it. And I loved the adaptogens because like it wasn't, I feel like you take a pill or you take a cream and you get a faster response. I feel like the creams actually they're gentle too. They sort of, I guess I'm thinking about you've got suppositories, you've got things you insert under the skin, you've got a pill you can take, you've got a cream you can apply. There's all these different applications for helping us shift our hormones in the direction we want. But then the adaptogens really felt like they were slower. They worked slower. I had to be patient. And that's why I was glad I used them sort of towards the tail end of my cream treatment that I was on. But anyway, thanks for that.
That's why I'm so proud of you, because I thought that's actually a way better synergistically harmonious way with our own bodies to nurture us. Because I always say hormones are sledgehammers. There's nothing gentle about them, and they're appropriate for if you're menopausal and you need support. It protects the brain, it protects the heart. There's so many good things about them. They're very appropriate, but they are big guns. So I always prefer the gentler things. Let's talk a little bit about applications, because it does matter. Oral is my least preferred for testosterone, for estrogen, not for progesterone. Progesterone orally is very effective and will convert to GABA. So if you have sleep issues, which is really common perimenopausally, oral progesterone is safe and effective, and I don't worry about it. But estrogen and testosterone have to go through the phase 2 of the liver, and they get metabolized, and you actually have to give higher doses orally to get through that liver first pass, and then what's in your tissues and what's used. And there's a little bit more risk of bad effects like clotting for estrogens, or even issues with breast or breast cancer, things like that, when you take them orally. So some people need that, but it's my least favorite way. Transdermally is the most natural. And you can do this in creams. There's commercially available patches, and those things go right into your tissues, and they act most closely like our ovaries do, just releasing them into your tissues. So that's a very safe way. It bypasses the liver, so you don't have that liver risk of stressing your liver or even toxicity or breast issues as much. And you can do testosterone, estradiol, or biased, any sort of estradiol, estriol combo, or progesterone transdermally on the skin. You mentioned pellets. Pellets are very convenient. People love them. Most commonly is testosterone pellets, but you can get other hormones like progestins or progesterones or estrogen. The number one question you want to ask your doctor is, are they bioidentical? Because you want the same thing your body produces, even if it's like, in a patch, you can get bioidentical estradiol, even though it's a patch that looks like a prescription. But you don't want progestin, which is synthetic progesterone. It's not the same. So you want to make sure whatever you're using, patches or creams or oral, it's bioidentical. And then those pellets, those usually last about 3 months. And the pros and cons are you get it once and then boom, you're good to go. But what I see on that is it's a spike of a curve, like say testosterone. You go way too high beginning, and then by the last 2 or 3 months, you're kind of tapering off to too low. And if it doesn't work, like say all of a sudden you grow a beard, or you're losing hair puberty,
You
right?
can't take it out. You can't stop.
Right. So I am
Yeah.
not a fan of pellets, even though people love them. And I have practitioner friends that do a great job. It's not a wrong thing to do, but you have to be aware it's kind of in your system for 3 months. And if you go wrong and you get too much or too little, you can't really change it.
Yeah, I've had a lot of success using the creams. Just one of the things I liked so much about the creams personally was how we were able to adjust the doses so quickly with a cream. Like you can use more, you can use less, depending on the response that you're having. And that felt really supportive to me, and why we saw such good response. I also really liked the new, since I had mentioned previously, I had COVID, and my estrogen levels had tanked along with my testosterone. And symptoms I was experiencing were like afternoon fatigue, and I started to just put on body fat more easily again, which was surprising because I had really gotten to a place where I was just in a maintenance mode again with my training and my nutrition and all of those practices. So I noticed when I was starting to easily put on a little extra body fat. So those were just some simple signs for me and then I was starting to have hot flashes. And
yes.
I was like, oh my gosh, I thought I got rid of these when we fixed my hormones last time. And that was my sign. I was like, Dr. Jill, what do we do? And I was going to say, I really liked this new Estrogen Drops. They're also a transdermal that you had recommended to me. I had never heard of them before, but so there were just basically there were a lot of different options for managing the hormone levels in the body. And this is something that I feel like I want to check in with you about sooner than later, because as a patient, I feel like your hormone levels it's a delicate balance. You want to be, once you establish a baseline where you notice that they're abnormal or something's gone wrong, I want to be testing again to see, are you having a response? How are you feeling? Let's look at the blood work again.
So typically 6 to 8 weeks is perfect. 4 is okay. It's a little soon, but often you can definitely see changes. And so anywhere between, but I agree. I think it's so key to follow, because you can say this is the standard percentages of hormones that we're going to use, but every body is different. And the thing you want to think is about, if you have processes with cytochrome issues, which again, this goes to genetics. So I can look at someone's genes and see a C1b, which is related to hormone metabolism. And I know, oh, they're going to not break down that estrogen as quickly as someone else. And because of that, I need to maybe give them a lower dose, or we could because too much estrogen is a risk of endocrine related cancers like endometrial breast. The one thing is the Women's Health Initiative, which came out like 20 years ago, initially started to look at safety, and they said there was all this risk. The final say on that data is actually that hormones are quite safe, especially if you start them right around the time of perimenopause, even with breast cancer. So I feel like I want to always empower women to feel like not scared. I am a breast cancer survivor. So I speak from a very important place, knowing I had breast cancer aggressively at 25, and I replaced my hormones in an appropriate way. And I feel that's safe to do it on my own body. And so I want to encourage patients that as long as you're watching it, working with a doctor who knows what they're doing, many cases are safe. And again, it depends on estrogen receptors. I don't want to go into all that. So if you've had breast cancer, absolutely check with your doctor before starting hormones. But there is ways to safely help your symptoms, even if you've had breast cancer, and especially if you're a ways out, like 5 or 10 years out.
That's a great framework and really valuable information. Both the, how we're testing our hormones, how frequently we're testing. That's really helpful advice. And for all of that great information about the different types of treatments available for women, you can read this article where I researched on my blog. There's an article about the adaptogens that I was particularly interested in and researching at the time. And there's a lot of information about how they all interact with your body. So that's a great resource if you're wanting to dabble in that. But what I guess another thing I really love about the practice of functional medicine is that you're not limited by just the drug. You are really have this broad palette that you draw from that takes into account a lot of different things that could be beneficial for someone's body. So I love that that's the focus, that there is such a broad focus. What can help this individual person? And we're looking at the root of what's potentially creating this abnormality in their system. We're looking at the framework of their genetic background in addressing whatever this abnormality is, so that we can really give them a full and comprehensive treatment. We were talking a little bit about COVID. I'm just thinking about the COVID situation and our immune system tanking. It's not just our hormones that tank, is it? It's also our immune system that tanks.
Yeah, so let's talk about patterns I'm seeing with long COVID. This is actually documented. This is not just Jill's personal opinion, but we see post-COVID, and in fact, one study recently looked at college kids, which are young and healthy, right? These are not the people that are dying from COVID. They're the young ones. They bounce back. They maybe barely know they have it. And they were saying 1 in 5 is having some sort of long COVID effect. The patterns I'm seeing are B cells. B cells are cells that create antibodies. So the things that create autoimmunity in someone who's predisposed, they're becoming more activated. So there is a risk for many people of developing new onset autoimmunity or more activation of their autoimmune cells in the long COVID or the post-COVID phase. Number 2, T cells. T cells fight cancer. They fight infections, especially viruses. T cells are being exhausted. I like that term, and I've heard it in the literature, exhaustion of T cells. It kind of sounds like the poor things, they're kind of like, oh, this is so hard. We've been through this pandemic. And it kind of, I just like that. It makes me smile because it kind of is, it's not like they are gone. It's not like you don't have them anymore. They're just tired. They're worn out, and they're not working as well. So we're seeing a ton of people after COVID develop shingles or develop reactivation of Epstein-Barr, new onset exhaustion or fatigue or other things related to the T cells not really working. I've also sadly seen some people who were fairly controlled with cancer issues and their cancer reoccurred, or they had to get more treatment or something. So it affects cancer, it affects viruses, and post-COVID, some people are seeing activation there. The third thing is those adrenal glands we talked about with menopause and perimenopause. Very, very frequently, I'm seeing low cortisol or dysfunction of the adrenals post COVID as well. And I think when we talk about hormones, that's one of the reasons why many women are either all of a sudden going into menopause after COVID or having more issues with hormones, because the adrenals, which should pick up the slack, are not working very well. And that might present with feeling overwhelmed, exhausted, more allergies or more reactivity to things. Maybe your gut isn't as healthy. And people can either gain or lose weight. They can have both extremes. So those are the kind of the patterns: the B cell activation, T cells exhausted, and the cortisol being low. And I see that a lot post-COVID affecting people's health.
I was just coaching a woman after one of our training classes in Rock Your Life the other day. That's the online membership fitness community I have. And she was telling me how after COVID, her allergies had just gone crazy. So that's just exactly, what you're talking about, and how the body just doesn't have the same resources available, and it has to rebuild them. So,
and one thing with that also, that's absolutely related. And then there's one more point I didn't make: mast cells, which are primordial. Right. They kind of protect us from the world, and they're kind of an early cell. They're not as well differentiated as the T cells and the B cells. but you've probably heard of mast cell activation. I've written a ton about it, but the mast cells after COVID absolutely in some cases get activated. And that would also explain some of the more allergic congestion, sneezing, even tachycardia or heart palpitations. Those can all be related, even leaky gut. When you produce more histamine from the mast cells, it creates more permeable gut. So it can affect all systems. And that's common post-COVID as well.
It's also common when you're dealing with mold exposure. I remember you helped to treat me with my masts. I had like a whole mast cell response as a result of the mold. And that was one of those things that it's really hard to pinpoint. So I'm glad you brought up the mast cell conversation. So many things out there that can attack our system. And it really brings me back to this baseline of resilience that we all need to build into our body. And we can build resilience in a lot of different ways, right? We can build resilience through what I just talked about, our 4 pillars of health, and, you know, the sleep, the stress management, the nutrition, the exercise piece that you guys hear me go on and on about all the time, and that help us be a better partner with our practitioner. But I also think that there's this side piece, not side piece, there's a huge piece, our intuition, our attitude. And this is something you talk about so much. And it's so refreshing to hear a doctor talk about, you know, that aspect of our healing. And I've experienced that personally in working with you, your constant support of me and my intuitive response and helping me believe in this process. And I just love for you to talk more about that, because I think it's such an important aspect of healing.
I think many people who go into medicine or go into healing in some profession are actually very intuitive, very creative. Like this is part of our nature as humans. And I always think of it like right brain, left brain, science, faith, masculine, feminine. There's all these polarities of life, right?
Right.
In medicine, traditionally, it's actually very, very driven by science and analytical mind, which is beautiful. But we're taught in medical school to not listen to any of the wisdom of the intuition because that has no validity. And the truth is, they both have validity. And now I feel like this dichotomy is so critical to me helping patients because I know analytically how to look at the labs. We just went through that, how to look at the data, the science. I love the science. But this intuitive piece is actually really wise too. And what I've learned is over time, if I'm listening and present with a patient and I have this feeling, oh, this feels intuitively like I need to either ask this question, go here, or suggest this protocol. And then we always back it up with science. But we can use that. And then, like you said, with the patient, I'm asking them, I'm checking in, how does this feel to you? What response did you get with that protocol? What happened with this? And sometimes they'll say, yeah, no, doc, I know you said this should work, but it didn't. I tried this instead. And I just listen to that because you know your body as a patient better than any doctor. And I might have the XYZ kind of protocols that work for most people, but if I don't listen to you and how your body responded or how you intuitively feel, I get so much data from that. And then I can still help guide and say, well, you know what, that makes perfect sense. Let's try this, or let's add this, or let's keep going like you're going. And I can either validate or say, oh, you know what, I totally get why you did that, but there's a concern here. Let's shift and move this way. But that's part of the intuition of medicine. And there's so much power there because we can process millions of things of data, whereas our analytical mind can process maybe hundreds or thousands. And you can process so much more on this intuitive level. It's subconscious, but if you listen to that, there's, I believe, as much or more healing power and information in the inner bodies.
And I think earlier I was saying there's something that you do where it's like a blending of science and art. Like you haven't, there's an art to the way that you practice medicine. And that's, I feel that intuitive and piece comes into it. And I started this conversation, this part of our conversation, by talking about resilience and how we build that resilient piece into our bodies the more we care about how we're taking care of ourselves and listening to our own body and seeking out these answers and seeking out like the care that we're able to receive. And also, like you had mentioned earlier, like if you don't like the way that you're being treated, you know, ask whatever questions you need, but also seek another person if you're not being treated the way that you want to be treated. I feel like one of the pieces of that's so important in healing too is that you feel that the person who's guiding you, that you trust them. And how can you trust that person if they don't trust you with your own body? If they're constantly making you feel like you don't know what you're doing, and that they're the one with all the power, and they're the one with all the knowledge, and not educating you. I don't know, you've always guided me to have faith in myself. And
Yeah.
that's a piece that I really appreciate, is because that self-belief, that faith, that really helps me. I think that's really helped me in my healing journey, like that trust in myself, and that you trust me and I trust you. And there's like this really important relationship there, that I feel like has really accelerated my healing, because I believe I'm going to get better. I know it might take a little while. I know that I might have a journey as I go through it and learn things. But I believe that I'm going to get better. And that's,
That
really been
is such
helpful.
a core. Like, I love that you're saying this, because I feel like in all my journey of like cancer and Crohn's and all the stuff I've been through and learned through experience, the most powerful lesson is what we're talking about right now. And what it is you have to love yourself. You have to have self-love and compassion and take care of yourself and be kind to yourself. But you can't really love yourself, love your tissues, be grateful for all that your body is taking you through until you trust yourself. And that self-trust is where I impart that for you, and you impart that to yourself as a patient or a client, because that trusting your own body has the ability to heal, and that your own body has innate wisdom is so important. And you really, really can't love yourself until you trust yourself to its
Yeah, and
core.
it's core, and but I think you also, like, that's what I love about you, is that you blend the science with this, because the broader the landscape of understanding of what's going on in my body below the surface, the greater
Mhm.
my capacity to love that process and to understand that
Yeah.
process, which creates all this space for me to trust the process. So I think it's important, like how you're holding the space for this conversation, that doesn't have to be one or the other, that it can be both. And that, because women are so empathetic and intuitive, and these are gifts and strengths that we have. And I think when we blend them with the scientific aspect of things, and we know science is always evolving. Look how much research wasn't done on
Exactly.
women in the past. Look how much more we're learning these days
Right.
about
Right.
what's the right way to treat people.
Yeah.
I mean, it's amazing. So anyway, I wanted to touch on that because of how much your new book, Unexpected, has such a big, it carries many of these themes through, and really draws from your experience of, like, what is it, like 20 years of practicing
Yes.
this way. So I just really appreciate all these aspects of medicine, and I appreciate how healthy I am. And thank you for all of your wonderful care of me and all of the other patients who you serve, and all the free information that you share, on your blog, like here in your new wonderful book, which we will link to in the show notes as well. And you can look it up on, I'm sure you can find it on Amazon. Just look for Unexpected and Dr. Jill Carnahan, and you can read more about Dr. Jill's personal story as well, like I was saying at the beginning. Um, I really appreciate this conversation so much. And they can find you on Instagram at Dr. Jill
Carnahan.
Carnahan,
Yep.
right?
Dr. Joe
Yep.
Carnahan. Exactly. Thank
And you're on
you.
Facebook, and you can find her on Facebook. I definitely recommend reading her articles on her website. They're great material to have at your fingertips. And that if you guys can check out the transcript here on the show notes page for the details of all of the things we just went through with all of those tests. And she's also got that great blog that you can read as well. And I really appreciate you framing that for people, with the affordability and accessibility of those tests, which we deserve to have access to.
Yes.
Like,
Yes. Amen.
that's the thing.
It shouldn't be
Yeah.
just for the well, like should be something that you can access and get information from your regular doctor, or even yourself, as we said, direct to the lab.
Yeah. Well, is there anything that we didn't cover that you would like a last word on?
No, but as we ended there, this be kind to yourself is part of that intuition. And I really feel like where our society is going, this is where the healing is going to be. I mean, all this other stuff is so important, but this next level of trusting and loving yourself, there's so much power there. So if I just leave you with one thing, start to be kind to yourself, trust your intuition as far as where it's guiding you, find a good doctor to work with, get the test, and know that you have the power to change this. You're not helpless, which sometimes we feel in the midst of these things.
That is so true, and wise words. And thank you again so much for taking the time to talk to us today. Really appreciate it. And thank you all for listening.
Thank you.
This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Brie Argetsinger, Betty Rocker Inc., and the producers disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. Before starting a new exercise, fitness, or health protocol, or if you think you have a medical problem, always consult a licensed physician.